G'day, Aidan. Thank you for joining us.
Thanks, Tony. Thanks for having me, everyone. And I'd just like to say that it's a real privilege to be able to be here and to talk to you guys. I'm really just here to try and help where I can. So I'm very happy with question answer type things. Men's mental health and men's support is a topic that's real dear to me. I think it's a really important initiative that Tony's done here, and I just wholeheartedly support it. So just try and be as useful for all of you as possible.
Thanks so much, Aidan. I really appreciate that. And I suppose we've all got some questions that we'd like to ask. I might kick it off by saying the ICU room at the moment, or the ICU area of any hospital at the moment, obviously has increased in its level of difficulty over the last few months. How tough is it in ICU at the moment?
It's it's actually been it has been difficult, but it's been difficult for reasons that are probably a bit unexpected. So if I just sort of describe the last couple of months, we saw all the virus spreading in Wuhan like everyone else on the media, and we looked at the initial modelling that predicted how it would impact Australia, and it looked like there was going to be this absolute tsunami of cases coming to Australia and into Victoria. And so really from sort of late January, early February, we've been in complete overdrive preparation mode, trying to prepare the hospital, prepare the staff, prepare the equipment, the workflows, how patients move through the hospital. And that in itself has been quite a massive effort. And we did all of this before we even had our first patient. And what's sort of continued now is that we haven't seen that big surge that was predicted, but we have instead had to change a lot of our workflows around the potential cases. And that's still meant quite a lot of work and quite a lot of change in how we do things, even though we've only had in the hospital not a huge number of cases.
I was going to say the government was always telling us about the flattening of the curve, and if we don't do that, the strain on our hospital system right around Australia would be enormous. We haven't got to that level.
No, that's right. So we're well within our capacity at the moment. And we, in fact, just walking around the ICU yesterday, we had probably about 15 beds that are empty. So normally we run at about 45 beds in the ICU. And leading up to this, we stopped all elective surgery. We diverted a lot of non-essential cases. And in preparation, we had 20 empty beds. And now we've probably got we've got 3 confirmed cases at the moment, and we have about another 7 or 8 who are potential cases that we're waiting for tests to come back. And then we have about another 10 empty beds just ready. So from a workload sort of perspective right now, we're actually quite low.
And in regards to patients who have suffered other causes, other injuries, I suppose, have you still been getting the same amount of those patients, such as stroke victims, heart attack victims, crash victims and the like?
It's really interesting. All of those numbers have gone down. Things like traumas and elective surgery and things, they've obviously gone down because people just aren't going out as much. But even things where you wouldn't necessarily expect it to be related to being outside, things like heart attacks, strokes, all of those have also gone down. So it's been kind of quite an interesting phenomenon that everything slowed down. The one exception has been cardiac arrests. That's been still quite high, the number that we're seeing. And there's some research going on about, what it is, maybe there is a relationship with some of these infections and cardiac arrest at the moment.
The morale in ICU, has it been of a good standard, or does it get fairly depressing in there at times?
Look, it's interesting. I think everyone deals with it differently. I think that some people have really struggled with the stress and the panic in the media and the change in routine. So, we sort of, all of us work in environments where we have a lot of workflows and routines. And what this has done is completely upended a lot of our workflows. And so some people really struggle with that. Whereas other people, maybe a bit more flexible, have thrived in that and really kind of really excelled and gone up and been able to lead at this time. So I think it's quite individual, and I imagine it's for all of us, even not just work related, but all of us, how we deal with this. You'll have some people that seem to almost are seeing this as a positive thing, that we're focusing back on home and focusing back on things that are important, traveling less, just these simple things. And other people who are really struggling and finding it difficult. So I'd say that the work people are there's a range. The interesting thing, I guess, what I thought I'd say is that, when I'm actually in the unit and looking after patients, we've cordoned off one area that we're calling the COVID zone, where the confirmed cases are and the suspected cases are. It's a little bit like being in the eye of a storm. It's actually really calm and really relaxed, and it's actually really nice working in there. And, we sort of deal with one patient at a time. We have very clear protocols about how to dress ourselves, how to do procedures, how to do all these things. And it just feels like we're falling back on our routines, and it is incredibly calm and quite nice. And it's when I take off all my clothes, put on the normal clothes, go outside, start going into meetings, start reading the newspaper, that's when my stress levels start going up a lot. Yeah. Because it feels like, this kind of panic comes on board. But actually dealing with people on a one-to-one basis is very calm and very straightforward.
Fantastic. Sean, you've got your hand up. Would you like to ask a question?
Yeah. Hi, Dr. Burrell. I'm actually, I guess what my question / concern is, this isn't going to go away anytime soon unless there's a vaccine. Is that right?
That's right, yeah.
So in other words, realistically, these lockdowns really should continue until there is a vaccine, because I heard in China they thought, oh great, numbers are down, there's hardly any new cases. They went back to some form of normality, and then 3 weeks later they've gone back into shutdown and lockdown and so on. So it's one of those things, as we're entering into the winter, colder months, this thing apparently thrives. So we're in a situation, and that's, I guess, what you're saying you're preparing for in ICU is, and more beds and so on, to keep this curve, to flatten the curve, we would have to stay into lockdown, I would imagine, for months and months and months until the vaccine's ready, right?
Yeah, I think I think that's basically true. I think that when we initially were seeing all the New York and Italy type of scenarios, it was looking like it was going to be one huge surge, a lot of people getting sick, a lot of people dying, and then this process where it's called herd immunity developing, where such a large number of people had antibodies against it that the virus just can't spread anymore because it keeps hitting people who already have had it. And then it kind of being very dramatic, but then going away. What the social distancing does is it stops that herd immunity, and it instead means much more of a slow, longer burn. But I think the thing is that it is a process of, I think I'm not a politician. I'm not sort of making those decisions because they're obviously balancing huge number of issues. But I think purely, I think everyone will have to be adaptable. So I think what you suggest about China, I think is happening now. They're starting to open up Wuhan now. I think there might be resurgence of cases, and then there'll be back a bit of a lockdown again, and then they'll open it up again. And there may be this process of closing and opening the amount of social distancing going on that we'll have to do here as well. And so I think that's probably the mentality I have, is that, yeah, one, this is going to go on for a long time, but two, there will be capacity to start relaxing all this social distancing, but we need to be prepared that we may need to go back down into a lockdown again.
Yeah. I paid particular attention to the lowering of the ICU numbers stats that you were saying, but strokes and heart attacks and so on are still up there now. Common sense would prevail that with all the loss of jobs and money becoming tight and the stress levels, not only males but females, would push these people who are probably teetering on the border of heart problems. That's going to be surging through all hospitals around the world probably. But have you found that that's probably a contributor to the cases being high?
Well, I guess time will tell whether or not the drop in cases that we're seeing at the moment of other non-COVID disease, what will happen when we start to open up the economy and things. But I think you're right. There are, for example, so we've stopped a lot of elective surgery at the moment. So people with narrow aortic valves, people with blocked coronary arteries, they're not getting their surgery at the moment. And that's safe for now, but those diseases continue and eventually they'll start also having problems. So you can't sort of stop elective surgery forever, otherwise it ends up being more problems with everyone. So it'll be, again, I think there's no clear answer now. It's going to be something that gets constantly reviewed and will be a kind of a dynamic that's adjusted as we go forward.
Aidan, thank you, Sean. Really appreciate your questions there, mate. Aidan, one of the really things that has hit hard for me is the fact that you hear stories of patients in ICU who have passed and they haven't had their family by their side and the like. And that must be really traumatic at that time when you know that families want to come in, but they just can't.
Yeah, that's a really good point, Tony. That's something that we've been working on in the hospital. I mean, just to describe what normally happens. So if someone, all of you may have had a person in ICU or in hospital die, I'm not sure, but essentially, it's a process really that family come together. It's really important that families say their goodbyes. People have religious and end-of-life care that they would like to apply. And it's a very human thing to want to see family and things, and most people want to do that. And with the COVID lockdown in the hospital, the sort of basic rule is no one is allowed in there other than staff and other than patients. And that's obviously to protect not only the people coming in, it's also to protect the patients, it's to protect really the staff, it's to protect everyone. And what that has done is it's stopped those normal processes of being able to grieve and be around family. And from my job as a doctor, it's to explain what's happening. A lot of people don't understand death and dying, and people need a lot of talking. And if we're not talking one-on-one, it's very difficult. What we're doing is we're using a lot of FaceTime, we're using a lot of Zoom, we're doing a lot of phone calls, and we're just kind of doing what we can. And for the most part, people understand and people accept, and people, I think it is harder, but I think people understand that that everyone's just doing the best they can. One of the issues is, particularly with the COVID patients, is they come in from the community, and it means that all the people in their home, i.e. their family, are also isolated because they've been in contact with them. So they can't come in at all. The one exception is, I mean, we are allowing, we're trying to allow people who are not isolated, who are not sick, in compassionate circumstances to come and say goodbyes. But that usually means not going in the room, but being in the hospital and at least being able to see their loved one before they die. or for that matter, for just being there to support them. So we do allow that, but it's only been a small percentage of people who fit that criteria.
Take us through the sense of satisfaction when someone actually does leave the ICU who has been there with COVID, and the fact that they get to walk out of the hospital.
Well, I would love to say that there's been lots of those patients, but we, at least in the ICU, we haven't had anyone leave the ICU yet. Overall, mostly because the numbers are very low. It's not that they're all dying, it's just that we've had low numbers so far. So, particularly longer term patients that are in the ICU for a long time, everyone gets quite close with them. The nursing staff are with them all the time, and they develop relationships, and it's amazing when people can get through this and survive. And, it's really why we do it, to get people out.
How lucky are we that we are in Australia, Aidan, in regards to what we see happening right around the world and the amount of deaths and cases right around the world? Australia seems to have fairly low numbers compared to those.
Yeah, and I think that's something that we all need to kind of remember, that when it comes to the panic and stress that we're reading in the media, is that we are very lucky. We do have very low numbers of cases in Australia, and we've got, for all the problems with our governments and health and all that stuff, and in fact it is one of the best healthcare systems in the world. And as I said earlier, we were able to watch all of this happening and had time to prepare a kind of a sensible response, and it's worked so far really well. So I feel very, I think all of us can feel very proud and very reassured that we're in probably one of the best places in the world to be dealing with this.
Richard, you've got a question for Aidan.
Thank you. Yes, there's been reports about different symptoms and so forth for people in regards to coronavirus. Is there any one symptom that stands out as being uniform? Because there seems to be a little bit of discussion at the moment that some people may experience one symptom, somebody may be something else, and so forth. Is there anything that seems to be a bit of a baseline type of scenario?
The commonest few symptoms are fever, high fever that's persisting. That happens in about 70% of people. Sore throat happens in a bit less than 70, 65. And a cough. They're the kind of the real top three symptoms, but everyone responds differently, and some people have had minimal fever and they've had diarrhea as their presenting problem. So it is hard that everyone is slightly different, so there's no sort of absolute, this is definitely COVID and this is not. But the commonest are sort of fevers and upper respiratory tract symptoms, and a cough, in terms of presenting symptoms. Sorry, go on.
No, sorry, go on.
I was just going to say, so it starts as an upper respiratory tract virus, like a typical sore throat or a cold. And then in a lot of people, that's all they have. And then they have fevers for a few days, sore throat, and then it goes away. And then in a smaller group, they'll develop a sort of a worsening cough and shortness of breath. And those people typically might end up in the hospital if their shortness of breath gets bad. But then by far the majority of those patients still will have a period in hospital, get some extra oxygen, and then, over sort of between 5 and 10 days, progressively improve and then go home. And then an even smaller group are the group that we see in the intensive care unit, who develop a full-blown sort of pneumonia with very low oxygen levels. And these people require more higher doses of oxygen and may require mechanical ventilation, where we put a tube in their mouth and we breathe for them. But that's a very small percentage of the overall number of people that are infected.
So for the people that don't end up in hospital, typically what is the timeline until the virus is either out of their system or I don't know what terminology to use, but where they may have got it, had it, and are no longer susceptible to it, that it's not having an impact? Is it 3-5 days, or is it typically a little bit of a longer period?
So it seems that once you get infected, you have fevers for a couple of days, And then if you are, and then you tend to clear it. But the people who don't clear it tend to have symptoms at about day 7. They start to deteriorate and then end up in hospital. So the patients we've had in the ICU are always around day 7 of when they develop fevers. But the people who don't end up in ICU, who just have a cold, I'm not 100% sure because I don't look after that, but I think it's around 3 to 7 days and then they're getting better.
Johnny Richard, thank you for that. Guy has a question for you, Aidan. G'day, Guy.
Aidan, thanks for your work. Thanks for spending some time with us. What do you think the prospect is of eradicating COVID-19 in Australia?
So it's probably unlikely until there's a vaccine. For a few reasons. One is it is reasonably infectious. So every single case can tend to infect 2 or 3 other people, unless you're doing quite aggressive social distancing, which we won't do forever. So I think there'll be a sort of a low grumbling rate because of that. And then the second thing is there's always, once we do start opening up to travel, there will be return cases that come back and will need the testing and isolation. So I think it's going to continue for quite some time. And it's just, a vaccine is probably the way to go. And that's going to take 12 or 18 months for it to properly, to sort of properly go through the population. I think what's more likely, though, is that we get the number of new cases per day right down, and it's already very low. I haven't seen the numbers in the last day, but I think it's 50 or 80 cases per day in Australia now. It's really dropped down.
Less, I think, 30.
Sorry, 30?
I think it was 31 last 24 hours.
So that number will probably continue to go down, but probably won't go to 0. And eventually we'll just have a very low rate of infection that continues. I think that's how it's going to play out. Yeah.
Okay, thank you.
Thanks, Guy. Appreciate your question there. And in regards to, you just mentioned the fact that we've got such a low number here. If we got to a period of time, say in the next month or two, where we have 0 cases coming through, does Australia stay in a good state then if we just close our borders from international and look after ourselves for a longer period of time? Will that sort of keep the virus away for an indefinite period?
Yeah, I mean, I think the closing the borders and, that has obviously worked. I mean, most of the infections we've had from Australia have come from Australian citizens returning home who are infected. We haven't had a lot of that community spread that has been seen elsewhere. So I think that's true. I think that there will be a balance at some point between having our borders completely shut and also allowing the normal activities and economic activities that people need to function. So I think, as I said, that the rate will probably go right down to very low cases, but it probably won't go to 0. And I think it will grumble along. So I suspect that's how it will play out. Yeah.
And a lot of us have maybe had coronavirus but don't know about it because we haven't all been tested. Is coronavirus one of those things where, as if you get it, then your body builds an immunity to it and you don't get it again?
That's right. So there's different types of, if I just take it back a step, so you have different types of diseases that cause infections, and some of them tend to be very stable. And so once you've had it once, you've got immunity for lifelong. Whereas some diseases tend to constantly mutate. And so, for example, flu, every year you have to get a new flu vax because there's a new strain that comes through that your body doesn't have protection against. And typically coronaviruses are kind of maybe halfway between the two extremes. So they do mutate, but maybe slower than a flu. And so that's why there's so much hope for a vaccine, because I think if we can vaccinate a large percent of the population, it will give us immunity and it will stop. But it may mean that in the future there's another mutation and we need another vaccine. But you know, time will tell how effective the vaccines are.
I'm going to throw some things at you, and these are some of the myths that I think we've had thrown at us over the last 6 or so months about COVID-19 and coronavirus. And I suppose the first one is, did this all start because someone ate a bat?
It does look that way. You know, I can't speak authoritatively on it really, other than, you know, what I've read in the media, like you all. But it does seem like, you know, in China they have this relationship with animal. They're very close. There's a lot of dirty markets, and they have you know uncooked meat and things like that. So it does seem like that's what's happened. That's what's happened in previous outbreaks. And it is just a dangerous kind of you know, behavior that happens in parts of the world. And if you spoke to an epidemiologist prior to this and said, if you had to pick one country where there's likely to be a new flu or a new coronavirus, they would have almost certainly said China, because of that relationship with animals and humans.
The washing of the hands and all that sort of stuff, we've all been getting right into that, probably more so than ever before. There's been a lot of talk about the fact that the virus doesn't live that well in warm water or warm weather, and that we should be drinking warmer drinks and the like to try and kill the virus down our throat. Is that all correct?
No, I think that's all total made up stuff. There's no evidence to support that. I mean, in terms of, you know, what you can do to protect yourself, you know, hand washing is the single most important thing that you can do. And if you do that, you really do reduce the risk of getting it by, you know, a factor of like 50. The reason is that the way it spreads is, you know, from respiratory droplets. So that's like, you know, coughing, sputum, wiping your nose on your hand. And it's always, when it goes from one infected person to another, it's almost always via the hands. So the only exception, if someone coughs directly on you, sure, but that's very rare actually. And even people who cough on you, the risk is not necessarily that high. It's more the wiping of your nose on your hands, and then it goes from their hands to your hands, and then your hands go up and touch your face. So if you, you know, you've probably read in the media, it's quite, you know, one thing to do is stop touching your face. It's quite hard to do that. We all do it, even when we're thinking about it. And so if you can wash your hands, it stops that link between the infected person and the and your face and your mucosa. It works really well. So you know, that's what we do in the hospital. Is we walk in and everyone just washes their hands, and you know that you've cleaned your hands, and that's the most important thing to do. Then when we leave the hospital, we do it again.
So off the back of that, you're obviously involved in more high-level discussions about things than we are with the hospital. What are some of the do's and don'ts that we really should adhere to over the next 3 to 6 months?
Look, you know, I think what the advice that we're all getting from the Department of Health, we just follow that. You know, they will be assessing the underlying rate of infection in the community, and so if that remains low, then what we can do becomes we get a lot more freedoms. If that rate starts to spike again, then they'll tell us that, you know, we need to do more aggressive social isolation type things. So that would be the first thing. Hand washing, as I just explained, is the single most important thing you can do. And then beyond that, I don't know if we want to talk about mental health strategies, but I think we need to kind of deal with, kind of accept some of those things, but then there's a lot of things we can do for our mental health. And I think that, for example, going out, walking, exercising, being in nature, you know, connecting with your family, you know, doing the things that keep you happy, that they're really important as well. Because as we were talking earlier, this is probably going to go on for months. So thinking of it in terms of a long-term marathon rather than a short sprint is the way to go.
It's actually been one of those more amazing periods, and I think for a long time, a lot of us have been talking about how we seem to be losing the battle with the world, and our kids, our teenagers are on their phones and on their devices all the time. And But this period has really seemed to have brought people a lot closer together, hasn't it? The air outside seems to be a lot clearer because there's not so many cars. We're seeing ducks in creeks and the like where we've never seen them before. The whole world just seems to be changing for the better.
Mm. Yeah, I mean, I don't know what the other people in this chat room think, but I mean, I agree. You know, this has a potential to kind of be a positive thing as well. We can refocus on the things that are important, and you know, I know that I've spent a lot more time. You know, our family time's improved. I spent a lot of time talking to my parents, and just I think the local park where I live in Melbourne is just completely full of people exercising and walking dogs, and never seen so many people out and looking happy and active. And I think it's really good. It's kind of emphasized the local again rather than the international. And I think we really need local connections and community as well.
Speaking of local, there's been some amazing decisions by businesses to change their tooling and the like, and have come up with some fantastic devices which has helped our medical fraternity over the last couple of months. I think the V8 supercar teams have started making ventilators and masks and all this sort of stuff. The innovation that we've seen in this period has also been great.
Yeah, I agree. I mean, at least from my work, and I mean, the big innovation for us is not going into work and being able to do everything online and do everything via Zoom. And I think that that's probably going to have a long-lasting impact for all of us. I know Tony's an accountant, and you know, I imagine that really all professions where they're not, you know, you're not doing a direct contact with someone, you know, it's going to revolutionize business, I imagine. And you know, I wonder I guess it's, I mean, you know, I think it will probably have long-lasting impact because we're already going online more, and then this is really just going to kickstart that. I mean, I know a lot of people commute into Melbourne, and it's you know, an hour commute, and they go into an office and all that stuff. And if you could kind of avoid all of that by doing meetings on Zoom and stuff, I think more and more people will start saying, "Hey, working from home is not that bad. Why would I commute for 2 hours or more?" And I think that, you know, I'm just speculating, but it seems to me like that's going to change things as well.
It definitely will be a different world in the next few months. There's no doubt about it. And we spoke earlier on about the motivation of staff. There's a massive appreciation from the people outside of hospitals for and the like for the work that you guys are doing. And it was fantastic to see the lights on the front of the Alfred Hospital with that big thank you over the last 24 hours. That must have really put a smile on everyone's face.
Yeah, well, I just learned from, was it Richard, that it was actually from the executive in our hospital thanking the staff. I wasn't sure who had organised that, but that, you know, it's really nice. And again, it's that kind of, that thing we were just talking about, the positives that come out of adversity, and looking after staff and the workers, and looking after neighbours, and all these things that are really great that we forget when we get busy.
Yeah, we certainly do.
You know, I work with, to give an example of the workers, the nursing staff. You know, when this started, there's a lot of fear in the staff about them getting infected, and you know, nursing staff have families and kids and all these different things that they're worried about. And I was just amazed. So there's probably about 5% said, I don't want to work with COVID patients. I don't want to put myself at risk. But 95% of the nurses said, this is my job. This is what I've been trained to do. I'm just going to go ahead and do it. And you guys tell me what the appropriate level of safe equipment is, and we're just going to do it. And people just roll up their sleeves and go and do it. And it's just really amazing. It's sort of how by far the majority of people just want to go and do their job and not complain. And it really, I'm incredibly grateful for the staff I work with. And
we're incredibly grateful to you, Aidan. And as a show of our appreciation, I'm not sure whether we can all do this, but I think everyone who's on the chat at the moment, maybe if we just give a round of applause to Aidan, he can pass it on to his staff on our behalf.
Thanks,
Thank you.
It's very kind.
Well done. And before we go, our CEO and founder of the Mail Hug, Tony Rabber, would like to say a couple of words.
Yeah, thanks, Tony. Aidan, I just want to say thank you for myself and our fellow board members at the Mail Hug. Really appreciate your time for today. It's very well, it's very much appreciated. And thank you for the great work that you and your staff are doing at the Alfred. And hopefully we all get through this thing and come out the other side much better. So thank you very much. Really appreciate it.
No problems. Thanks, everyone. Thanks for letting me be part of this, and look forward to the next one.